Well, healthcare in this country is, as you probably know, about 4 times as expensive it is in comparable countries. Why that's the case is hotly debated, but one former hospital president says predatory pricing by healthcare providers is partly to blame. Stephen Weissman was previously the president of Palm Springs General Hospital in Hialeah, Florida. In a recent piece for the Daily Caller, he pointed out that a simple blood test can cost between $10 and $400, even if it's performed at exactly the same lab. Prices, he says, are phony, and they make price gouging inevitable. How do we fix this? Stephen Weissman joins us now. Mr. Weissman, thanks for coming on.
Thanks for having me again, Tucker. Great to be with you.
Everybody, I was thinking about this today, everybody grouses about how much health care costs, and understandably, but a lot of people are getting rich from it, especially here in Washington. I personally know a lot of people who have made a ton of money off the health care drama. And so is there a connection between the amount of money that's spent lobbying on health care and the dysfunction in the health care system?
Absolutely, Tucker. You can call me a cynic, but the healthcare industry spends more on lobbying than the oil and gas industry, defense industry, and aerospace industry combined. And
Whoa.
I can tell you that all our politicians are approaching the problem from the wrong end. Everybody's got a healthcare plan, Tucker, which you probably know better than anybody else in the country. It's repeal Obamacare, replace Obamacare, amend Obamacare, and all of the plans are based on the false idea that we have an insurance problem in the United States, when what we really have in the United States is a healthcare billing problem, a medical price problem. Insurance is only there to pay the medical bills.
Right.
Medical bills is what the real problem is. And the one thing that every politician avoids talking about like the plague is medical pricing. Healthcare pricing is sick, Tucker. There's no such thing as a market price.
So why, I mean, the two-part question is, why do they avoid talking about something as obvious as the price of medical care? And two, what do you do about it?
Well, let me just, I'm assuming it's hard to believe that this is an issue that they're missing. I think it has something to do with the lobbying power of the industry. You're right. Everybody is getting rich on it, from the providers through the insurance companies, hospitals. You know, you ask the price of any service, you can't get a straight answer. The only answer you'll ever get is, what insurance do you have?
Right.
Everybody's price depends on how much can be extracted from you personally. And the consumer, the patient, is helpless and hopeless. We can't shop because there's no real pricing. We depend on the healthcare provider to tell us what our individual price is supposed to be. But what nobody will tell you is that the patient that comes right after you for the exact same service may be paying 1/10 what you're paying, or 10 times more than you're paying. And the price everybody else pays other than you, it's literally protected in the United States as a trade secret. You can't find out what it is. The solution is easy. Have legitimate health care pricing, just like we have in grocery stores, department stores, gas stations. Nobody would accept walking into a grocery store and finding out that everybody's being charged a different random price. The store owner would probably be charged with 50 different types of discrimination. But somehow...
How do you do that? I mean, everything you've said makes sense. Why is it so hard to get from the concept to the reality? What would you need to do?
Well, Tucker, I have to say, I don't want to butter you up too much, but the truth is the nation owes you a debt of gratitude, because it appears that I'm the only one talking about health care pricing, medical service pricing. I've never heard anybody discuss it before.
Huh. And it seems so obvious. So it's obvious who's benefiting from it, because by the way, it's a handy way to shift costs, of course, and to redistribute the costs across a broad population. But it's based on lying, it looks like.
Absolutely. Let me give you an example. I got a call a couple of weeks ago from a lady in Texas, and this is, unfortunately, half of your viewers have probably had an experience like this. She told me that she's been going to a doctor for years, getting a treatment that cost $150. In the past year, she got health insurance. She's about 60. Her and her husband are paying $1,800 a month for health insurance. She went to the same doctor that she's been going to for years, and he said, look, your rate is $325 now. She says, hey, I've been paying you for years, $150. What are you talking about? He says, well, with your health insurance, that's the network price. That's the allowed price. You haven't met your copays or deductibles. And she says, hey, just pretend I don't have health insurance. He says, no. You know, I've got a contract with the health insurance. That's the allowed price. I'm obligated to charge you that. And the truth is that under the current system with Obamacare, health insurers have been incentivized to pay more out for medical care, because under the current law, the only way an insurance company can increase their premiums and profits is to pay more out for the underlying medical services.
Right.
They're required to pay out 80% of the premiums they collect for actual health care services. So how could it possibly be that an individual can get a better price than a health insurance company that theoretically is negotiating for tens of thousands
Right.
of patients?
Exactly.
And consumers all over the country are learning, and there's been a lot of articles written about this, that your best bet is to go to the doctor and pretend you don't have insurance, because you're going to get a better price quite often than the network pricing.
Well,
in what world?
That's exactly right. And that's clearly the answer. Unfortunately, we're out of time. I hope you will come back, because this is a thread we're going to continue to pull. It's at the heart of everything. Stephen, thanks a lot for coming on.
Thank you, Tucker.